bum bum bum. Ba-da-da-dum bum bum ba-dum ba-ba-dum. Rum bum 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 ba-dum bum 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 bum. Ba-da-da-dum bum bum ba-dum ba-ba-dum. I've got my voice back. Yay! It's so nice to sound normal again. Hi, folks. Good evening. I see you, Susie B. Hi, Alice from Toronto. The snow just keeps falling. Oh, what happened in Toronto today? Unbelievable. That plane just flipped right over. Wow. Excuse me. Quite a lot of news going on these days, my friends. Hi, everyone. It's Monday night at 8 o'clock Eastern Time. My name is Joette Calabrese. And, whoa, there's a thumb in the picture. My husband's trying to arrange the camera a little bit better. There we go. And we do one thing and one thing only every Monday night. We meet and I teach you homeopathy. I teach you from my experience and from my studying and my reading and my time spent with great homeopaths, etc., teaching, especially teaching. After teaching tens, I don't know. I've always wondered how many students I've actually had. At one time I counted, now I've forgotten, but thousands, many thousands of students. And because I teach thousands of students, I get lots of questions. And because I get lots of questions, the teacher learns more than the student, my friends. And so that's why we're here on Monday night. And for those of you who already know me, welcome, friends. Hi from West Palm Beach. And is this not good enough? It's making me, yeah, there we go. All righty. So tonight we're going to talk about potency. Why? Because, my friends, potency matters. And it's something that used to frustrate me when I used classical homeopathy as a classical homeopath for 15 solid years. And what I mean by that is I was in practice for 15 years and I used only classical homeopathy, and it drove me crazy because there were no formulas at all. It was theory, and more theory. And so before I get into potency, I want to read something to you from Pradeep Banerjee and Prasanta Banerjee's book, the Banerjee Protocol book. And I'm reading from page Roman numeral 14, and this is what these are Pradeep's words. I'm sure that Dr. Prasanta had a hand in this, but boy, does this sound like Pradeep's words, because this is how he used to talk. The title of this little chapter is The Central Problem of Classical Homeopathy. I'm reading from the book. He says, lack of standardized treatment. What's standardized treatment? That means for this condition, we use this medicine. And when we use this medicine, we use this potency. And when we use this medicine and potency, we use this frequency as well. Lack of standardized treatment protocols has stalled scientific validation of the efficacy of homeopathic medicines. Sounds familiar, doesn't it, in a way? If you pull that apart and you understand what he's saying, he's talking about the problem of classical homeopathy. This has also produced an inability to conduct clinical trials owing to the mystique, I have it underlined, and so it disturbed the word. The mystique created in choosing medicines for administration to patients. Yes, there's been a mystique around it, hasn't there? Not so the way I teach this, not so what I've learned from not only the Banerjees, but Joepathy and the French protocols as well. The mystique is what throws everyone off because there is no solid scientific information. For this reason, the true healing potential of homeopathy has been repeatedly challenged and denied by mainstream medicine. You wonder why mainstream medicine doesn't accept homeopathy? It's because it sounds woo-woo. Not this method, not with protocols, no. With the method that says that 5 homeopaths seeing one patient the same day, at the same moment, If they're classical, we'll come up with 5 different medicines. That is not standardized, my friends. That is a mystique. There's only one simillimum, they say. I used to say the same thing, my friends. I was in that camp for 15 solid years, actually even longer than that. I practiced full time for 15 years, but before that, I was studying it, and I also taught it. For this reason, the true healing potential of homeopathy has been repeatedly challenged and denied by mainstream medicine and the scientific community. Thus, the system of medicine is at risk. It remains at risk of being delegated to the archives of history. If we look at medicine as being mind, body, spirit, I'm sorry, I don't treat spirits. I've never met anyone's spirit. We use the name of the condition and the remedy that is assigned to it, along with its potency, which we're going to talk about today, along with its frequency. And we also use symptoms because symptoms never lie. They're gifts. So, we don't want it delegated to the archives of history, do we? And I believe, my friends, that until we really got this going with practical homeopathy, teaching people how to use Banerjee protocols and other very useful protocols, that's exactly what was happening to homeopathy. It was dying on the vine. It was too esoteric. It was too hubris. It was too coveted by a small group of homeopaths, and it was relegated to only those people, those very special people in very special organizations and very special knowledge that turned out to be less than adequate, my friends. So I'm going to talk to you about potency tonight because it is one of the factors that goes into choosing a medicine. And choosing a medicine for a specific condition. Now, as a classical homeopath, every time I went to my classes in Toronto, New York, New Jersey, Ohio, Florida, wherever I went, the teacher, as long as the teacher was a classical homeopath, they would never tell us the potency. You had to figure it out yourself. Not only would they not tell you what remedy to use for what condition, they would not tell you the potency. And then they would not tell you the frequency. And it was all up to the subjective wherewithal of the student / homeopath. So, let me ask you, how many of you think that the more serious the condition is, it's a chronic condition, let's say, that the higher the potency ought to be? I'd like to know. I'd like to know who thinks that way. Or who's questioned it, or used to think that way, or still think, or wonders or ponders that question. How many of you think that the more serious the chronic condition is, the higher the potency ought to be used? Yep. No, says Kelly. Yeah, people are responding. No, low potencies can treat cancer. Thank you very much, Veronica. Or Veronique. Thank you very much. There are low potencies, my friends, that we use that are Banerjee protocols that treat the most serious of conditions, the most serious of chronic conditions. And I will tell you one of them. Oh, nay, says Pat in Kansas. You've got it. No, because the 3s and 6s are very helpful. 3s and 6s can be extremely useful. We can use low potencies for cancer. We can use low potencies for anemia. We can use low potencies for chronic migraines. We can even use, I'll go to my next question. How many of you think that the more intense the emotion, the higher the potency? In other words, if someone has a little sadness, we could use a 30. But, excuse me, if someone is suffering great anxiety, that's when we must go to a higher potency. Now, I was trained that way, and I used to use that for a long time. And sometimes I default to that, which I have to admit is something that is a mistake. It's not the way it should be used. It should not. We should be using what we know came from the great homeopaths, master homeopaths, not someone who has a new theory. We want to use information that's coming from someone who has thousands, tens of thousands of hours and meeting with tens of thousands of patients over a long period of time. That, my friends, is what makes a master. Not someone who has an interesting theory online. Not someone who has an interesting theory in a school somewhere online. Because I have always used Ignatia 200, twice daily, I might add. There's that frequency and potency. I've always used Ignatia 200 twice daily for someone who has grief. Now, does it mean that if they have severe grief that we must scale up? We must climb that potency ladder and go to 1M, a 10M? Or can we count on a 200 potency, which I consider middle? I guess most homeopaths would consider that a middle potency, whereas a 30 is low, 6 is low, 3 is low. But my friends, there are a lot of French homeopaths who have been using homeopathy in this fashion for very long and use very low potencies for such conditions, for psychological conditions. So instead of using or thinking we must go to a very high potency, doesn't mean we don't ever do so, but it doesn't mean that we can't also use it in a low potency and get just as much value, particularly if it's used at the right time in this person's life, just as they're suffering, and perhaps repeating it a little more frequently. And how many of you think that if a medicine doesn't act, you should increase the potency and creep up the potency ladder? It's kind of what I was just saying a minute ago, right? Yeah. Ignatia 200 was a lifesaver after my dad died. I started with it twice a day and would sometimes take it up to 4 times a day on bad days. It's awesome. You bet it is. Mostly use it more frequently, not scaling up. Thank you. Absolutely. I agree with that. Because the body's using it up. It's the body's suffering from the grief, and you need perhaps to use it more frequently. So even though we start with, say, twice a day, that's an average situation where there's some grief. But if the person is suffering relentlessly, then we're going to use that medicine more frequently. It doesn't mean we never use a 1M of Ignatia. It means it's more likely we need to use it a little more frequently. I love Ignatia, says Adrienne. What a difference it makes in anxiety and overwhelm. And Jessica says, my aunt just found it that she has breast cancer and had surgery, and they took it out supposedly, but now the doctors tell her she has to have a port, take radiation, and take a chemo pill for 7 years. Here we go. Dr. Christy Corder says, nope, Pulsatilla 6C is great for my overly emotional Pulsatilla child. Yes, you've got it, friends. This is how it works. And so the rules that we try to attach to these medicines, the rules we try to attach to these conditions, to the frequencies, all of these rules, you only use this then, and you can't repeat, and if you repeat, it's going to cause a proving, and if you use it too frequently, it's going to suppress, etc., etc., etc. Those, my friends, are rules that, in my estimation, are flaccid. They're outdated. They're, I don't know, collywobbles. They don't hold enough strength, but they're given to students and put out there into the world, because when you're using a paradigm such as the classical homeopathic method, which, by the way, Hahnemann never used the word classical. Classical is a new word as of the 70s and 80s. We find that if it's the right medicine used at the right time, that even a lower potency acts. But what we love even more is that we have protocols. Now, let me tell you, my friends, when I found Now, let's put it this way. I knew there had to be protocols. I suspected it for years. It made sense to me because I learned of a few protocols. I learned that the protocol is before you go in for surgery, use Arnica 200C the night before and the morning of, or the morning of and just before being wheeled into the surgical arena. That is a protocol. I knew that if a child hit his head against the coffee table and got a goose egg, the protocol was Arnica 200. Sometimes Arnica 30 would do just as well, no doubt. That's a protocol. Is it not? I learned when I was still classical that there was a protocol for when a child got strep throat, that belladonna was the medicine most likely to be used best for strep throat. So we had the condition and the remedy. And then the potency I learned was to use a 30. This was not taught by classical homeopaths. No, it was kind of secretly shared amongst the students. We also knew a head injury, a severe head injury, would call for a very high potency of nat sulf. So why did we have to pussyfoot around? Why did we have to share this information quietly? And why were there not more protocols? Because if there was a protocol for this and this and that, why couldn't there be a protocol for everything? Could it have been, my friends, that the problem was that classical homeopathy, when taking a case, takes so excruciating long to take the case? It takes a minimum hour and a half. And then after that, it has to be repertorized. That there was no time to see enough people, enough clients, enough patients, in order to learn what the protocols could be. The patterns were not able to be determined. The patterns were not there because there weren't enough patients for the homeopath to see all of the patterns. But when we have someone like the Doctors Banerjee, who saw 100 patients per day per doctor. There were 12 doctors in that clinic. There still are. That they say, when they're seeing 1,200 patients per day, because there are 12 doctors each seeing 100 patients, after a while, especially after years, even decades, patterns emerge. And the patterns are clear. This is the condition. This is the medicine. This is the potency. And this is the frequency. Yes. So, how do we determine potency? We're going to start, my friends, with a protocol. Now, you don't have all the protocols, do you? Unless you're in my academy, or you've taken a lot of my courses, but also in my academy, you're not going to have all of them. You're still not going to have all of them because there are still many more conditions that need to be addressed by protocols. But I also teach that we can extrapolate to a certain degree from the protocols that we do know in certain circumstances. But let's put that aside for a moment, shall we? When we need to know what the potency is, we start with a protocol. And you can find them by going Joette Calabrese and then the name of the condition, and I give you the protocol. So it gives you the potency. Or you can refer to my blogs. Yes, my blogs, podcasts. But it's not all about me. I want you to learn this also from the Banerjee, the Pratik Banerjee, the Banerjee Protocol book. Unfortunately, that book has been hijacked. It is pirated now. And we're hoping to get that back out again in its pure form once again. But if you have the protocol, we start with the protocol. If you don't have the protocol, then I'll try to give you somewhat of a rule, okay? Let's start with this. Most pharmacies, homeopathic manufacturing pharmacies, I'm talking about the real ones, those that are have been regulated for many years. They have been associated with, they've been regulated by the FDA in the U.S. and in other similar bodies of regulating organizations in other countries, such as Helios, but we're talking about OHM Pharma, and let's see who else we've got. Boron and some others. When they construct a kit, which is maybe 50 remedies in the kit or 28 remedies in their kit, they're choosing the medicines that are the most commonly needed for household needs. So what they choose is based on what is most often found to be useful. They're not just arbitrarily choosing. So if you look at one of their kits, we see that most of them are in the 30th potency or a 200 potency. Sometimes we also see some 6s, some kits that are in 6C or mostly 6C, but also we see 6Xs, also for cell salts. And so if we know that those are the most commonly used potencies used by, put out by, developed by the pharmacies, then we can pretty much make some assumptions. And one of the assumptions is that indeed those are the potencies that will most likely act in many conditions. Now, we know there are thousands of human sufferings. There are many conditions. And so if we start with acutes, I like to use for an infectious situation such as an eye infection, conjunctivitis, or an ear infection, otitis media, or sore throat or something like that. I am most comfortable with a 30th potency. It doesn't mean I never use a 200, but I most often use a 30th potency. Does it mean it's an absolute? Can we not use a 6 or a 12 or even a 9 potency? Doesn't mean we can't do that. But we use the medicines that we have, especially when we're not following a protocol. We use the medicines that we have in the potencies of about either a 30 or a 200. That's for acutes. Now, what if it's a severe injury? Extremely painful injury. Now we're going to perhaps go a little higher potency. We might use a 200 automatically. But we can also go to even higher. We can use a 1M sometimes. And I'm also going to tell you that if the remedy is used frequently, let's say at the onset of the condition of the injury, using it every 15 minutes, a 200 potency every 15 minutes for the first hour, and then assessing where that suffering is, then we can often count on a 200 potency acting. More often than not, my friends, the reason medicines don't act is not because the medicine didn't work, but it was probably administered incorrectly. And even more often, it was used for something that wasn't there. In other words, sometimes people say, I'm pretty sure I have a problem with my thyroid. I'm pretty certain. Well, how do I know? I'm not getting it tested, but I'm pretty certain because my hair is thin and I'm fatigued and my skin is dry on my legs. The lateral aspect of my eyebrows is thinning. And so they automatically use a medicine, maybe a protocol that's specific for hypothyroidism, and they declare it didn't work. Well, perhaps it wasn't a thyroid condition at all, after all. So we must be certain of what we're using these medicines for. And once we know absolutely what the condition is, we don't have to know all the exact diagnosis, but we want to at least have a basis from which to jump to a medicine that is specific for a condition. We need to know that that is the condition that we should be treating and not make assumptions. The fewer assumptions we make in medicine and in human health, the better off we will be. Okay, let's just see what folks are saying here. People are still talking about Ignatia. Yeah. My son had strep throat 5 times last year. I wish I had found you then. I was so close to getting his tonsils, getting out his tonsils, I think, but something told me no. Belladonna is in our future if he gets it again. Now, let me also tell you, Jesse, belladonna is one of the main medicines, but there are others as well, and I want you to be open to that possibility. Okay. Let's just see what else we've got. How would you know if your Banerjee book was hijacked copy? There's misspelling. if there are misspellings in the book, and you'll see the misspellings more often in the names of the remedies. Okay, I'm recovering from total knee replacement 4 weeks ago. What is the best remedy for pain and stiffness versus pain, or addresses both? Vicki, I would urge you to go to Joette Calabrese pain and joint or knee pain, etc., and you'll find it on my blog. Thank you, Donna. Okay, so people are responding to each other. Okay. I'm very sorry about the Banerjee Protocol book. I wish that I could be more involved, and we are working on it with Rinku Banerjee. Let's see. Yeah, Thompson's in Quebec is great for Canadians as well. They're in Quebec and in Toronto. Good pharmacy. I've been using homeopathy for the last 5 years, and I learned the best way to learn potencies is to have an illness and use the remedies frequently if the pain is extreme in a 200C if I don't have a protocol. Very useful to go through it. You bet. Veronique. Let's see. What type of diet would increase blood sugar? I'm not going to go into diet tonight. We've got so much to finish talking about. I'm suffering emotional pain from a strange 30-year-old son. Best remedy for emotional pain. Go to my course titled Mindful Homeopathy. You go to Joette's Learning Center and scroll down and go to the course Mindful Homeopathy. Oh, let's see if we've got more here. I heard about the documentary. Okay, Frozen. Let's see, replying to Vicky. People are helping each other, which is just wonderful. Let's see what else we've got here. Yes, you're absolutely right, Jennifer. Original Banerjee Protocol had gold edge pages. And also Susie B's for tonsil says, also Merck Soul. Yes, belladonna is great for strep throat, and Merck Soul for tonsils. I read Heap Ourselves 6 should be used for dental gum infections. Heap Ourselves 6 is very good for those kinds of infections that are on the gums but not deep into the bone, etc. How are we doing on time? Let's see if I can answer some more questions here. Let's see. Yeah, I see comments from multiple platforms. Facebook, please, friends, subscribe on YouTube and share. It really does help get this information out there to more people. People are wanting to know about 10Ms. I don't like to talk about 10Ms to the general public, my friends, because I don't know to whom I'm speaking. I know some of you, but I don't know all of you. So that's when it makes a difference if you join Joette's Mighty Members. That's when I talk about things that are not out to the general public. Jennifer says, what is the remedy for infection in the bones and dental? Again, we're not going to get to that tonight, but I do teach that in my academy, and I also teach that in the antibiotic course. Again, Joette's Learning Center, scroll down to antibiotic course. Let's see what else we've got here. Tonsils, people are talking about tonsils. Old trauma. Yep, okay. I'm about to go to my Mighties, and that's the group that I'm more comfortable answering questions that include a higher potency, such as 10M. I don't use 10Ms generally, except for a couple of specific protocols that are actually not even Banerjee protocols. But I think it's very important that people who use a high potency really have an in-depth understanding of homeopathy. I've had far too many times people come back to me and say, oh yeah, I've been using that 10M for the last year. I take it every day. That's actually happened to me. That's worrisome to me. And so I want to make sure that those who I'm teaching, I can teach with more confidence that that they are a little tighter to their understanding of how I teach. All right, my friends, I'm about to go to Mighty's, and I'll see you next week. And we may carry this conversation on. We'll see how far it goes. Thanks a lot, and I'll see you then. God bless you all, and stay here, Mighties.